staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This episode is brought to you by Gainswave. Gainswave is a treatment done at your doctor's office to optimize erection quality without the needs of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a Gainswave provider, go to gainswave.com. That's GAINSWAVE.com. This is Mark L. White for Health Hacks, and today we have Colleen Higgins, owns a dispensary up in Connecticut and is an expert in teaching doctors how to reduce your pharmaceutical load, teaching patients on how to reduce their pharmaceutical load using cannabis. Everybody talks about this green rush, right?
Absolutely.
And, it's funny because like I'm familiar with it. I use CBD products. And right now with what's going on in the country, it's January 2021. I read this article today that 1 in 6 people are suffering from mental health issues so bad that they're seeing a therapist. And I'm thinking, man, they should just freaking smoke a joint or, relax. We'll all be better off. But, like I see people on Xanax and all kinds of things. Well, what would you recommend when people have high anxiety levels?
I think when people have, so many more states are, first of all, thank you so much for having me. I'm excited to be here. I appreciate it. I would say that the most important thing to know is that if you have access to a dispensary in your state, that's going to offer you a lot more products. For now, patients usually start with an over-the-counter CBD product, and CBD is great. It's fantastic. It's one component. There's over 100 cannabinoids going on in the plant. It's just one. And this one has no psychoactivity. It's got its fame about 10 years ago when it started to help out with some children's seizure disorders, but it also offers some relaxation, especially at higher doses. So yeah, it's a good start for patients to, you want to make sure your dose is okay. A lot of patients will underdose and then think it doesn't do anything for them. But for doses between 50 or around 20 to 50 milligrams, it's a good start for patients to see if it'll work for them. If not, you would then need to go to a dispensary, and that would offer you the other cannabinoids like THC, which does have the psychoactive side effect. All of these work on the endocannabinoid system, which is linked to our fear response. You don't really hear the word fear in medicine, but there's a fear that is created, especially where our mind goes, our emotions follow. And a lot of vets will say, they're allowed to walk through that fear when they use cannabis, where before it's just a fear like we're dealing with now that can be suffocating almost. So yeah, I agree with you. Everybody, if you don't smoke a joint, take a little edible, relax for a few hours, and I agree.
So how did you get started at this? Like, were you like, did you smoke back in college and you said, you know what, this is the future, or is it something you just did recently? Tell me a little bit about yourself.
I did. I've been a pharmacist now. I've been in pharmacy, I should say. I've been a pharmacist for a little over 20 years. I've been in pharmacy since 1991. So I've seen a lot. And I dealt with a little bit of depression in college, and I really leaned heavily on cannabis. Whenever I've had anxiety, I've tried all the prescription drugs, just like most people. I've tried the benzos for relaxation and sleep issues, and the other sleep. I probably tried every sleep medication out there, and they don't work. You get about a couple hours of relief. You also have the potential of withdrawal, which I'm not a big fan of. So I did try more cannabis in college, and I found that for me and for most people that where it works for them, that it was an instant. You can find out how to use it. You can learn how to dose it. And when you do it properly, everything kind of just falls into place in terms of that relaxation and anxiety. It's not, I call it a tool in the tool belt. It's not the end all be all. It's just something to help in the process of dealing with anxiety or sleep or pain. And it's a great tool that we've got now.
It's amazing. We have all these pills for, like, we have the benzoids, we have antidepressants, we are still in the midst of a huge opioid crisis. Yet all this, we still have the scheduling of cannabis at the federal level, still a Schedule I, which means that these things have no medical use.
Mhm.
how did we get there? I know there was reefer madness in the 1920s, but like what led us to this, and how are we going to get out of this where this has mainstream acceptance?
Well, in my book, in the cannabis prescription, I cover that right in chapter 1. It was never based on science. What's the biggest motivator for people in this country? Money.
Money, 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 money.
Money. So you had Hearst and you had Big Pharma, and they saw cannabis come in, and then tie that in with a little racism, and you can immediately get that. They started with the laws that was debunked, and then Nixon came in and scheduled it as a class 1 substance narcotic, and that took away all the ability to use it and research it, right? So we didn't discover the endocannabinoid receptor system until the late 80s, early 90s, which is a shame, because now we're finding out the benefits. I had no idea as a pharmacist. The drugs I was giving out were not helping people. They were sometimes making it worse. So when I work in the dispensary, and I don't own one, just to clarify, I hear the patient stories of how they failed time and time again. And as a pharmacist, you don't hear that. They just don't come back, right? So to hear how many people were failing on these pharma drugs and learning how cannabis works in our body in the receptor system to cause different effects, and the different cannabinoids and the combination and the entourage effect, it's just a great option for so many patients that don't find success with the pharma drugs.
No, because you don't see this embraced by mainstream medicine, it seems that like people that are using CBD or THC, we have to kind of like figure it out ourselves. I know there's an anti-inflammatory effect, there's an anti-anxiety effect, there's a pain effect. But how does one go about coming up with a proper dosage, knowing, like knowing whether we use full spectrum CBD, do we do it with THC? Like, where do we get this information from?
Great question. My book covers a lot of it. That's exactly why I wrote it, is patients. I was giving out so much information, and you could see the eyes glaze over, and they're like, okay, I'm full. So I talk all about CBD as a molecule, as part of the plant, as in combination with the other molecules as well. How to pick a good product, because these days, the over-the-counter products are not regulated like the pharmaceuticals. You can pretty much put anything in there, and until it causes damage and somebody sues, you don't know what's in those products. So it's important that you look for a good quality product. I start talking about the other cannabinoids. For instance, in Connecticut here, we now have CBN, which is another mildly to non-psychoactive molecule. We have a T8 THC. So THC is normally delta 9. THC has that strong psychoactive feeling. We have a T8 delta tetrahydrocannabinol, and it has a whole lot less psychoactivity. So for patients with cancer, anxiety, there's a lot to be investigated in this plan. And we really got to get the propaganda gone. And I've seen it in Connecticut. More and more doctors quickly get on board because they run out of options with pharma. And this is what they see is working for their patients. And the safety profile. Let's not forget about the safety profile and non-toxicity, Mark. If you take too much of an opioid, you stop breathing. It's not the case with cannabis. So it's the safety profile is extremely important.
You take too much cannabinoid, you eat a bunch of pizza and fall asleep.
Exactly. You get fat.
A lot better than dying.
Yep.
They passed that farm bill a few years ago where somehow hemp got lumped in with marijuana. Correct me if I'm wrong. I'm not a doctor, but these are cousins, right? The hemp plant is a cousin to...
It's the same. It's actually, there's a lot of confusion, and I covered that in my book a little bit too, because I found it so interesting that even today we can't seem to figure out. There's still arguments about the naming system. That's just happening a few years ago. They can't quite figure it out. So you have cannabis, right, as your header, and then sativa and indica. They didn't even recognize those for a while. Those are not based on the cannabinoids. Those are based on the terpenes. So an indica and a sativa are THC-based strains. They have a high amounts of THC, but the terpenes can cause them to be more wakeful or more sleepy. Hemp is defined, it was actually a cannabis sativa, but that misnomer is not being accepted by people, so they just call it hemp. And hemp was given the legal term of having higher amounts of CBD and less than 0.3% THC. So that's the definition that's latest for hemp, is less than 0.3% THC.
So sativa and indica, when I think of indica, I think in the couch, because you take indica, you don't want to leave your freaking couch, you just want to watch TV. But sativa is like, walk me through like the difference of sativa versus indica. What does it do in terms of effect?
To do with the terpenes. The plants look different. If you're looking at a sativa plant, it looks a little skinnier and taller, and an indica is shorter and fatter. And an indica is more body relaxation. So you feel the more body relaxation, which for certain pain patients is what they prefer. I've had, and we'll cover the gamut. We start with CBD typically, and then we'll just kind of move our way to find something that works best. I had a 91-year-old patient recently. She started off with CBD. It actually made her pain worse. So we moved over to THC, and she ended up with indica all day long. Every 4 hours, she was taking a pretty good dose, 15 milligrams, and she was 91. And that's what finally helped her pain. So I've seen patients, they kind of get used to that relaxing side effect, but that works best for their pain. And sativas, I've seen patients, they have the limonene and some other terpenoids that add kind of a perk. And so for depression or for daytime use, they're actually extremely effective for patients that have intractable depression, I've seen, in my experience.
Like with sativa, can somebody take sativa and go to work? Does it, like we worry about, I guess on the other side, we worry about safety, people driving while stoned, people operating machinery while stoned. Yeah. Is there a case to be made where people can take a product and actually function?
Sure. I think the most important thing with any medication is dose, right? So if you underdose, you're wasting your money and your time. If you overdose, you're going to not be feeling so well, especially with the psychoactive drug. So we want to make sure the dose is really effective for people. We can look at microdosing where we don't have the psychoactivity. Once you start to build that dose up, that's when the psychoactivity can get really prominent. And I got to tell you, I wouldn't want my surgeon taking some THC before he goes into work. Okay,
I wouldn't want that either.
There are certain professions that you want to have as sharp and clear-minded as possible.
Yeah, your pilot. You don't want your pilot flying your plane just smoking a joint.
No, not so much. So it's important to look at all those factors. There are certain professions that need to be as sharp as possible, but you also can look at dosages. And for other people who do suffer with depression where they can't function, they can't go to work, this could be a tool that would help them.
Now let's talk about the different ways people are using product. There's flower that we smoke. There's vape. There's edibles. What do you recommend? Are there certain benefits to each one, or is everything the same, the way we take it, the way we absorb it?
Very different, very, very different. And that's what's the biggest benefit about coming to a dispensary is you have all the different delivery systems available to you. So you have topical creams, which can work very, very nicely for a lot of people who have arthritis in the hands and on the feet, pain in the feet, and they would apply that several times a day. You have inhalation, which is either smoking or vaping. A lot of people actually prefer to vape the flowers, use a flower vaporizer. It's the purest way. Or you have vape cartridges that are full of oil, and you want to make sure that those are pure, and you don't want to have any kind of dangerous diluents in those. Those work immediately. Within seconds, you get relief, and you can tightly titrate your dose. So it's just a tiny little puff, 2 to 3 seconds long, and then you can take a second puff after 10 minutes. And then the edibles, they really have the longest duration, but they also take a while to kick in. So you have about an hour for most people, and then they work about 4 to 6 hours. So for patients with chronic symptoms, 24 hours a day, 365, they really tend to work more with the edibles. Although if they don't like them, if they don't like the effects and how they feel, then they'll go back to the inhalation, or a lot of patients will combine both, that quick action and then the longer action maybe for sleep. So lots of options.
It's your CBD, because of it seems that CBD has become so unregulated. I was stopping at a gas station a week ago, and right next to Milky Way is a thing of get your CBD drops here. And, that to me is scary, because when you think of like using this to help with medical issues and the fact that anybody can sell CBD, we don't know what we're putting in our body.
Right. The one thing I tell people all the time, Mark, is don't buy your CBD at a gas station. So funny you brought that up. But I also would say you have to be careful with, I always think about the weight loss supplements. Extremely dangerous, right? A lot of liver transplants are caused by these supplements that have high levels of green tea. They think it's so a little's good and a lot is better. A lot's not better. A lot's going to break your liver down and cause you some serious problems. So you do want to make sure that you get it from a reputable source. You want to make sure it's made in America. You don't want to buy any products that are made in China. You want to find out where it's grown, who's the farmer, who's the, everything that you possibly can. We have a lot of CBD stores popping up around here, and I will stop in and talk to them and find out where it's made. I like to get a sample, see if I can feel it, see how it feels. I found some really great products, and then I found some that you don't really feel too much of anything in. So I would say if you can sample the products, make sure you know where it's coming from and that it's grown in America. Super important.
Yeah, I've tried different CBD products, and I've tried like the 500, the 1,000, 2,000. The thing about it is you don't really feel it. You don't. I don't know if it's that I'm getting a bad, if these things are just not made right, or are we supposed to feel CBD? Is it something that just builds up over time?
CBD, I felt the one that I tried, but mine was also a full spectrum. So it also had CBN. I looked at the back, CBN, CBG. CBN has some relaxation to it, so that's why I probably felt a little bit more relaxation. Also higher doses. If you look at the literature created by GW Pharmaceuticals, which they're the makers of Epidiolex, which is the plant-based pharmaceutical CBD supplement for the seizure disorders. At higher doses, they do list sedation. So if you are feeling that not much is coming out of a 10 milligram dose, maybe try 20 or 40 or 50. We have doses that go all the way up to over 100 milligrams. So sometimes a higher dose can be better. If you find that you get up to 50 milligrams and you're still feeling absolutely nothing, I probably would skip the product. Really high doses of CBD have caused patients kind of stomach cramping, and then a headache, a low-grade headache that just doesn't seem to go away. That's kind of a sign that your body it's not a product for you, and it's a little high of a dose.
Right, now, you mentioned this term full spectrum. Could you please elaborate what that means?
Sure. So a pharmaceutical mentality is to isolate a single molecule. Take the CBD out and then isolate that molecule. When you have a full spectrum product, you have as much of the cannabinoids in there as possible. So you're looking at possibly terpenes, possibly flavonoids. The other cannabinoids I'd look for would be CBG, CBD, and CBN. You'll never find a THC product over the counter, but as many of the cannabinoids as you can get in that product are exactly what you want. Try not to find ones that have completely isolated the molecule and put nothing else in.
Now, I have seen over-the-counter CBD, but it'll say on the back that this has 0.3% THC, and I think that's like a loophole to get some THC in there.
That's got to be a loophole because that's all you're allowed, right?
Yeah, but if you're allowed a little bit, if somebody takes a lot of that, are they going to get the psycho? Is that just too little to do anything, or is that something we should be concerned about?
Yeah, I think it's probably too little. You probably get the negative side effects from the CBD before you got any psychoactivity from the THC. And also, when you blend high doses of CBD with lower doses of THC, the CBD tends to mellow out the psychoactivity of the THC anyway, so chances are you might get some relaxation, but not really any psychoactivity.
It's funny because I cannot take THC because I get too goofy and like I can't even freaking function with THC. But if I take a little THC, like a CBD 4 to a ratio of 1, it seems to work really well. But does the CBD, does it cancel out why does that work like that? Because I thought that was so fascinating.
Right. It is. It just works on the psychoactivity portion. So it doesn't actually work on the relaxation the molecule is offering. So for pain and anxiety, we find that the combination of CBD and THC actually work best. For patients that deal with anxiety, sometimes THC actually goes in the wrong direction. So when we combine it with that CBD molecule, you mellow out the psychoactivity and they have a more clear head, that will usually work better for anxiety. So it's just the psychoactivity portion and you still get the relaxation and the anti-inflammatory action from THC. THC is a great anti-inflammatory as well.
How about for things like ADHD, attention deficit disorder? Do you see any use of either THC or CBD for that?
Good question. We actually see something interesting, and we're asking more and more patients. Sometimes patients do not find that the indica, the indibed THC is relaxing for them. It stimulates them, and the sativa is the one that relaxes them. And if you look at what ADHD drugs do, like Ritalin or Adderall, when they take them, they calm down, right? So,
and it's an amphetamine too, so it should, like most people, and I have ADHD, and I've taken Adderall before, and that calms my brain down. It keeps me from overthinking.
So it's the same concept where a
Wow.
sativa that would normally kind of perk somebody up calms them down. So we tend to have them take them when they want to relax at night. And if they wanted to have something that they were a little bit more energetic with, then they use the indica instead. So it's actually opposite. It's not everybody. It's kind of something we just ask when we see patients that are using sativas for sleep and to calm down if they have ADHD. And we're finding that a few people do. And we should start tracking it. It'd be a great study.
Now, on state levels, some state like Florida, we have medical marijuana. We don't have the recreational dispensaries. I don't know. Is Connecticut a recreational state, or is it just medical?
Not yet. New York just went recreational, so that'll be coming up. And we're expecting Connecticut in the next couple of years will too, because at this point we're surrounded. We got Massachusetts, New York, New Jersey. They've all gone recreational, so it's only a matter of time.
Well, let me. Are you concerned at all, like if it's recreational, that people are going to be, if they're using it for, to calm down or to get some sort of medical effect, and it's recreational, how do they get the right advice to know what to take, or is it kind of just a free for all?
You would, well, they could contact me. They could contact me. So on my website, either Colleen Higgins, R.Ph, or Sway Innovations, I just have people ask me questions whenever they have a couple simple questions. And I also offer coaching for patients that need some more advice. So for recreational, you are kind of stuck. My best friends live in California, and they complain all the time that they don't get a healthcare professional. They get a bud tender, and legally they're not allowed to give out medical advice. So you would like to have somebody that has some medical background, especially a pharmacist. We understand your drugs and all the drugs that you're on, and we can compare them to what cannabis can do. So it starts with training more healthcare professionals. They're not getting that education in pharmacy and medical schools, unfortunately. So it starts with that, and then patients are just going to kind of have to seek it out, unfortunately. In a medical dispensary, you're given that support, but in a recreational dispensary, you're going to have to search for it. And a lot of times what I find is that patients just need it at the beginning. They need to learn how to dose it. They need to learn how to increase their medication as they're going. And once they're off and running, they're golden. They may need a little touch up here and there, but they start to understand the delivery and how it makes them feel and how to adjust it if they need to. And then they don't really need to speak to somebody so regularly.
How did you learn all of this? Because obviously you're not learning this in pharmacy school or in medical school. Like, where are the specialists getting their information from?
There's a lot of studies. My book has over 250 studies in it. So there are a lot of studies actually going on around the world, and they're usually international because they're ahead of us. But Canada also has a legal cannabis program that's incorporated into their healthcare system. And I'm on Twitter at Colleen Higgy. And I talk with a lot of the doctors. So when they put up their doses of what they're giving patients, hey, I had a patient have successful symptom relief with PTSD and CBD. I'll say, hey, what dose are you giving? And that was about 20 milligrams 3 times a day on that one. So you talk and you find out what's working for other people. And there are a lot of studies going on. I know that the politicians say, hey, we need more studies, but they're there and they're just it's about, in my opinion, it's a lot of money going on that's going to be changing when cannabis becomes a Schedule I drug. We're talking about big money in big industries such as pharma, alcohol, tobacco. So, we've really got to get the studies that are government supported. That would be fantastic.
Now, do you see where medical schools are going to start teaching MDs or medical professionals on how to use dose THC and CBD, or do you think it's always going to stay kind of fringy?
I think once it's changed from a Schedule I to a Schedule II, the whole thing changes. Doctors now are going to protect, and I don't blame them, are going to protect their schedule license to write controlled drugs, right? Their schedule license so they can write those controlled drugs. You legally cannot recommend a Schedule I drug, right? So every time they do, they're putting their license at risk. So they don't want to do that. Teaching it in school, I've checked with, I'm actually approaching universities around here, and I was approached by a doctor in Texas who may want to incorporate my book into his program. But I think when the scheduling changes, everything changes. Up until now, it's the patient that's going to suffer. If we can't teach these healthcare professionals coming out of school now about the cannabis plan and the components of it and what it can do, and start to educate them, they're going to be behind. You have to be self-driven in this field in order to find the information out there.
Now, other drugs that you see out there, specifically LSD, magic mushrooms, psilocybin, you see states like Oregon that are legalizing this. Do you think that we're going to start seeing those drugs also being available? Are there clinical uses for that? Have you studied that?
I haven't looked into the mushrooms, the magic mushrooms and the psilocybin, but I think I'm happy to see them arrive, because if we're looking at it from just a clinical perspective, the limitations on antipsychotics, antidepressants, we focus on the serotonin system, right? We focus on serotonin, norepinephrine, dopamine, and we expect that to be the end all be all for depression and for these mental health issues, and it's just not. So you still have patients that are suffering deeply, and to have another option that is covered and provided by a physician and a medical expert, I think is fantastic.
So we see mainly, we were talking about mental health issues and mental health conditions. We're talking about the anti-inflammatory conditions, excuse me, but do you see what other things are we successfully treating using CBD? What other medical conditions?
Just CBD, I'd have to say moderate pain, mild to moderate pain. You got to get that dose up to an effective dose. So pain, for more severe pain, you typically need some THC in there as well, but pain is being well treated with cannabis. With just CBD, some people, mild anxiety, mild things, mild anxiety, inflammation. CBD actually had a great study for Parkinson's. A lot of Parkinson's patients, I think the Parkinson's chapter in my book is one of my favorite, because even I didn't realize that the Parkinson's pharma drugs are not doing anything for us. They're helping mildly with the symptoms. They often offer a lot of side effects, and as you progress in your Parkinson's, then you are taken off a lot of these medications. You can't take opioids, you can't take antipsychotics. So CBD, actually, there's a study out where with a REM dysfunction, these patients will scream and yell and sing sometimes at night when they go to sleep. They were given CBD doses before bed, and 100% of the patients had a great response. 0 symptoms overnight, they went away. And when they took the CBD away, the symptoms reappeared. So for Parkinson's, some of the Parkinson's symptoms, it can work on the brain with the anti-inflammatory action, and it does help with those. But like I said, a lot of times if we can add THC in, we get even better results.
So is THC, what else does that help with?
THC is a great muscle relaxer. So if we have patients with MS, a lot of the muscle relaxers by pharma just are really not effective. And so that's a great muscle relaxer. It's also great for pain as well. That's the one that kind of kicks in for the fear and the anxiety, especially when it's combined with CBD for those patients that really have that extreme fear and anxiety. It's also great for sleep. I don't see patients with more severe sleep issues finding effectiveness with CBD. So an indica THC, either Delta 9 THC or now the new option of Delta 8. These are also great things for sleep. And sleep is a big deal in our country. All those sleep medications are fast movers in every pharmacy you go to. So it's nice to have another option for sleep.
So for sleep, it's indica, now when you say Delta 9, that's a different type of strain?
Delta 9 THC is what we think about marijuana. That gives the high feeling. Delta 8 THC just changes by 1 bond. It's suddenly the psychoactivity is much more mild, but you still get a deep relaxation. So for patients with anxiety or nausea, because that's the other thing, THC is great for nausea. When we're talking about cancer patients, CBD is just not going to do it. If they're not comfortable with the psychoactivity, this is a great second option.
Okay, now this is all great stuff. Now tell me about your book. Like if somebody's listening to this and they want to get your book, what's the name of the book?
The book is The Cannabis Prescription, How to Reduce or Replace Pharmaceutical Medications. Nice big long name. So The Cannabis Prescription, Colleen Higgins, if you look on Amazon, or if you come to my website, there's a link there as well. And It's gotten great reviews. I'm very, very happy. I launched it the week that we went into lockdown with COVID. If you check the date, I thought, ugh, what are we going to do here? But I needed to get it out, and it's gotten really great reviews, and it's gotten some great buzz. So I'm very, very happy with it.
Great buzz, no pun intended. And on your website, are there any resources where if somebody wants to go to your website, can they download anything or get a cheat sheet to all this?
I do. I have some links to, actually, I have a great link if you're wondering about the pharmacokinetics, big long word, pharmacokinetics of the cannabinoids, THC and CBD in the body. There's a link to that too. It's actually a government study. I have a lot of blog posts. The latest one I put up was on neuropathy. There is a lot of CBD is actually great for neuropathy for a lot of people, especially at higher doses. So I was on a podcast earlier and he asked about some studies. So I put some studies up on some CBD used for neuropathy. So if you sign up for my website mailing list, you'll get access to all of the blog post information that I put up usually once or twice a month.
Okay, well, I'll make sure that we have links to all of this. To your website is swayinnovations.com. They have all the information. I really appreciate your time. I think right now everybody needs to know about this because I think right now we're having a mental health crisis going on top of COVID. I guess that's one more question too. Is there any studies that show that this helps with COVID or helps with the COVID recovery or the anti-inflammatory response?
There was a study. I actually wrote a blog post. It's on my website about COVID use and the oils being used for the symptoms. I talked to somebody who's a grower in Rhode Island, and she was using the oils for her COVID symptoms and said it worked out really, really well. You're dealing with the potent anti-inflammatory. These are patients that are typically taking higher doses, not just the over-the-counter type of stuff, but it can also help with the relaxation and the pain as well. So yeah, there was, whether we have direct treatment of it, THC is actually an antibacterial. So whether we can actually treat that at some point, we'll have to see. But remember, we got to play with that psychoactivity. That's always there, hanging off in the end about where we can dose it. If you take too much of that, you're not going to feel so good.
Well, I appreciate your time. Colleen Higgins, swayinnovations.com. Check it out. Great stuff. I'm actually going to download everything and definitely going to get your book. It's really fascinating. Thank you so much for your time.
Thank you, Mark. Appreciate it.
My pleasure.